define our roles and responsibilities, albeit they're shared, how we're going to work together and how we're going to move this agenda forward. But also how we're going to articulate our vision ourselves, not one that's been defined for us. So we've done that work over the past year. One of the approaches that we took through engaging a global partner called Rios Partners, they work on really socially complex issues, and believe me, health and all of its complications is pretty complex. And we've invited them to come and work with us here in Manitoba, and we're the first and only First Nations that this organization is working with in the country, and so we're really excited to be able to do this work and use their methodology, but also braid it with ours and our culture and our beliefs. And so what this document starts with is kind of some ideas of what the future could look like, what those possible scenarios are. And I know people have asked us, well, why are you doing the work of possible scenarios? And my response to that is, we know what the last 50 years look like. What could the next 50 years look like? When we looked at Wabang, and our grandmas and our grandpas and our aunties and uncles that did that work, they knew exactly what the next 50 years were going to look like, but they still weren't listened to. And so we wanted to reimagine that work for our upcoming generation and for the work that we're all going to leave behind. And those possible scenarios were designed and developed by a number of individuals working with SCO, FINISM, MKO, and a partnership with the University of Manitoba, and of course the Assembly and Rios Partners. But in total, we had about 75 participants from our communities and from different organizations. And we took a population health approach. So it wasn't just health care, it wasn't just about the healthcare system. Education was there, CFS, as well as housing and other infrastructure needs. So we've summarized some of these stories of possible tomorrows, and then we've quantified them with a health economist as to what that could actually look like. But if we're projecting what our needs are going to be into the future, what do we have to plan and prepare for? And what do we have to steer away from? And what these scenarios are telling us, there's 4, and we've named them as outlined there. So I was trying to get away with not wearing my glasses, but I can't. Dominion, Dream Catchers, All My Relations, and Sun, Grass, and Water. So under Dominion, under the possible story of Dominion, it is continued status quo. It is continued government control, both federally and provincially, into over all of our aspects of our lives and our society. Under Dream Catchers, it's more about the global forces and technology and climate change and what that could look like as it affects our lives. And then with All My Relations, we're looking at enhanced authorities, enhanced or greater control over all of our systems and then what that looks like. And then with Sun, Grass, and Water, we're looking at full self-government and full control. So those are stories, and what those stories are telling us is that if you look on page 5, if you have the handout, we just quantified some of those costs under 5 particular drivers or considerations as we were doing this research. And so what we wanted to know about what that future looked like as it relates to our health or health status, healthcare system performance, expenditures, self-determination, and client satisfaction. So on page 5 in the graphs, you can see the 4 scenarios are in blue, yellow, red, and green. And green is Dominion or status quo. You can see that if we remain under the control of the federal government, that our healthcare costs are actually going to more than double in a couple of decades. This is the cry for investment now. And you're also going to see that there's no self-determination, that there's no client satisfaction, and that our health systems are are performing very poorly. The preferred options with respect to what we want to walk toward in towards our future or strategic considerations would be more towards the scenarios of all my relations, which is greater authority, greater control, which is what we're all working for, if not full self-determination. But as we begin to scope what that looks like from a program and service or an authority perspective, the first thing that we have to understand is what's everything going to cost and can we afford it? We've done some preliminary work with a health economist, Alan Beaudry, who's also, he was at the last assembly in May. Many of you met him then. This is some of his work done to date, and there's still more work going on. And Alan is also a graduate of our medical school, so he's doing his residency in internal medicine now, so there's not very many physician health economists, so we're pretty confident with these numbers, albeit preliminary. There's a chart on page 7, and I believe there's a single page that might be copied a little bit better in your binders as well. And so what this is showing us that currently or last year on reserve expenditures, we didn't do off reserve, including both federal health expenditures as well as provincial health expenditures. Just under $1 billion is spent on Manitoba First Nations living on reserve. That's about 10.5 to 11,000 per Manitoba First Nation or per capita, as compared to around 4.5 thousand per Manitoban. So twice as much money is spent on Manitoba First Nations in this region. But all of our health indicators are telling us that regardless of that amount of money, that we're actually still pretty sick and getting sicker, or the indicators are really slow to change with respect to the ratio investment. For a long time, we've also heard from yourselves, from the chiefs and from other communities, this idea of First Nations entering into direct transfer arrangements with Canada as it relates to the Canada Health Transfer Payment, or what Canada provides the provinces to support the Canada Health Act and coverage of insured services. It's a hard number to get, but we understand that estimate for Manitoba, so from Canada to Manitoba, to be about 95 million for Manitoba First Nations living on reserve. You'll see that that means that Manitoba Health, or the provincial government, is subsidizing insured healthcare services upwards of 75% in this region. So the idea of Canada going into a direct funding arrangement with Manitoba First Nations would be funded at a quarter of what the actual costs are. So this covers hospitalization, your emergency visits, your physicians, all of your diagnostics. Those are all the insured services that the CHT payment is supposed to be paying for. So that's something for us to think about as it relates to whether we build parallel systems, whether we're going to have integrated or coordinated systems. Those are going to be for discussion, and it's not just about the affordability, or at least what kind of formula you have to design for your negotiations. Any questions about the money, or we'll wait? The work that we're continuing to do with the fiscal analysis is framing a needs-based healthcare system. So what would First Nations actually need if we were to truly improve the health outcomes of our community members and our individuals? So the next couple pages, some pictures from the workshops that we have done over the past year. You can see all of the contributions made by our colleagues. and our communities. There's a draft shared vision, some strategic directions around strengthen and heal, protect and assert, and build and invest, as well as some relationship guiding principles for your consideration. This is all draft and rolling. We don't expect to have this document finalized until the middle of September, and there'll be a number of validation exercises with our community partners and our organizations as we move forward. On the last page, there's a proposed tripartite planning and negotiation structure. You can see that it is a multitude of different tables, and it is inclusive or respectful of the political unity accord to include AMC, SCO, MKO, and the AFN. At the higher level of negotiations, it's those 4 organizations with Indigenous Services Canada, as well as the Ministry of Health, supported by a health transformation transition team, experts or executives or clinical experts in health and project management, and those individuals are to be determined. At the oversight and approval of scope, we have the First Nation Health Tri-Council, made up of the Chiefs Task Force on Health, of which there's a resolution for you to review and consider in a moment, with ISC and Ministry of Health representatives at the REO and ADM levels. And then with respect to the planning and scoping of authorities, or should say enabling legislation, our multi-jurisdictional advisory teams in 4 particular domains, first being legal and fiscal relations advisory team, operational and workforce advisory team, community health programs advisory team, and clinical programs policy and standards advisory team. And of course, ongoing engagement and consensus building through multiple existing tables and community visits and invitations to other systems. So I know you're all tired. I know it's the end of the day, and so I'll leave the presentation at that. It is ongoing work, and there are resolutions to be considered. Thank you.
Questions? Chief Batson?
Hi, Chief Batson, Pine Creek First Nation. Do we have that resolution out already? Because I can't find it.
Has the health resolution been circulated?
No.
Nope.
Okay.
Yes. Microphone 10.
Chief Mitchell, I have a question for you. Are you part of FINISM or FINISM? First Nation Health and Social Secretariat? Yes or no?
No, I'm part of AMC.
AMC? Okay, then my question is there any table for, you're talking about needs-based? Do you have anything on particularly the challenges that are faced by isolated communities? Is there a working group? Because there's lots of things lacking in our, as you're all aware, that we don't have the same access to services as people that are on the road. So if there's any working groups, I want to be involved in it because we have our unique needs. Okay.
Absolutely. I know that, and I don't mean to speak on their behalf, but I did have a chance to sit with Debbie Reed, who can just maybe wave over there, who's the transformation lead for Southern Chiefs organization. And so they'll be entering into a pretty comprehensive planning process as well. And I believe MKO is doing a similar process. And so we're trying to work really closely together to, from an AMC perspective, to explore or design enabling legislation so that those programs and services can be improved at the community level through what our partner organizations are working on.
Well, let's remind the three organizations that they work for the same Indians, please.
Yeah.
Okay.
Thank you. Microphone 26.
Hi, Chief Batson, Pine Creek First Nation. So just as I guess a follow-up in looking at your chart here, you have under negotiations the AMC, SCO, MKO, and AFN. Has that process been started? Because as far as I know, I'm the chair of the Chief Health Action Table for SCO, and we have not been contacted by AMC to have a discussion on this process. You know, and we have been working on it for some time now, so like we're ready to move forward, and we're going to move forward with our southern communities. So I think you know, we don't want to be held back or just to stop the process that we've already started, and we're looking at incorporating our grassroots communities and really trying to get at the, when the chief mentioned about what are the needs in the community, that's what we're really wanting to assess those needs and to get our communities involved at the grassroots level so that we can really be comprehensive in our approach. So that's where we're at. Yeah. So now I'm interested to find out a little bit more about this resolution. That's why I asked about it. And to see what, you know, if that is going to impact us in any way, because we are ready to move forward with our initiative. Miigwech.
Absolutely, and they're very complementary processes, and so there should be, what AMC is proposing is to focus on enabling legislation. So the best way I can explain that is just by giving a couple of examples. I know you're going through your needs assessment and your design phase currently and for the next few months. One of the examples I shared this morning would be the Health Professions Act, right? So a lot of this legislation is designed without us at the table, but has huge impacts on what that service looks like in our communities. So nursing thought that they were doing the profession a huge favor by expanding some of the nursing scope and prescribing abilities for general duty nurses primarily throughout all of Manitoba. But what they didn't consider, and there were some restrictions, what they didn't consider is that that particular legislation reduced the scope of advanced practice nurses working in nursing stations. So whereas before I could, if I'm one of those advanced practice nurses, I can give you a full prescription of amoxicillin. Now I can only give you a starting dose, and I have to call a doctor for every single order for that client to receive any kind of care and treatment. That's across the board. So that's an example of 30,000 feet looking at legislation so that it's enabling for communities, for Southern Chiefs, for MKO, when their plans are ready for implementation, that you're not going to be met with these policy barriers or these legislative barriers that don't support comprehensive health care. As one example. Another example is the Regional Health Authorities Act, right? In that particular act, the province does not have any capacity, any authority to flow money directly to a First Nation or a non-RHA recognized organization. So they look for little flow-throughs, right? And that's not deserving of our communities. So those are higher level examples of what we're going to be looking at from a legislation perspective, so that when you're ready for implementation, you won't be met with the same barriers that we see today. Oh, microphone 8.
Good afternoon, Melanie. My name is Don McKay. I'm the councillor for Pemichigamakri of Chief Bonias has appointed me as the proxy for nation and our people. But first of all, I just wanted to introduce myself, as I've been the elected leader in my community for the last 18 years consecutive. So I've been working on health most of my time as a council member in my community, as Melanie well knows. And I think she knows my position and my issues on health overall in my community, and as well as some of the chiefs mentioned here about the other big X factors and gaps that are hanging over our First Nations people up north. And it's a very different environment health-wise with our northern people, because our people have a lot of traveling to do to come up from Cross Lake, Norhouse, Nelson House, Tatasquac, wherever it may be. So it is a 12-hour drive for our people on a bus. So with this health accord, if there's going to be a universal health accord, that it should, belong to the people, and the people have to have ownership and control over our health services, because it is a lot of disparity between the health services down south and up north. Our urban towns in here down south, and they have a population of 3,000 people, they have a hospital setting, and we have nursing stations up north which don't have the capacity and human resources on the floor, professional specialists on the floor to attend to our people's objective health standard needs. So that this health accord has to be very uniform and has to be very specific to meet our people's demands. And it is hectic and it is terrible. It's a mess, I would say, that I still refer to medical services. It's the FINI or however the ISC, I don't know what they call it now, but health is very primary for our people up north. And anything that we discuss around the table as chiefs and councillors, proxies, or anywhere else with the overall health of our people, it is standard. It is same everywhere, I would say, and we have to stand together to come up with one voice, one rule to empower our health status up north and anywhere else and First Nation communities. Because I always say this, Canada boasts itself as one of the third healthiest countries in the world, and yet we are Canada's backyard. Our health is a mess, and it is terrible. So we have to address this health together. One voice, one rule. Because as chiefs and councillors, this is my chance to say this here, because my elder just passed away, always advised me whenever he can, do what is good for our people in the best interest of our people, is this: never lose your treaty status. That is amended in the treaty obligations of the Crown. But it is becoming so, I tell you, because our status expires. This is what my elder told me. Take it up, bring it to the chiefs where it can be addressed. Because when you look at your status card, it has an expiry date there. And when that date expires, that's when your treaty status expires. You expire yourself. We expire ourselves. And we cannot let that happen. That has to be on a health accord as well. And I would recommend, because I am only a proxy here, and I really feel for my people in my community when I say this, that their treaty health status cannot expire. If you go to the pharmacy and take your status card there, and they see your treaty status expires, I'm sorry, you're expired. I cannot prescribe your medicine. Those are the type of things that we have to look out for. And we have to look at it in a very, very serious way, in the best interest of our people and the relationship between the Crown nation to nation. That's how we are supposed to approach this, because I'm speaking on this health issue, because this is what I seriously take in my responsibility as a councillor in my community. And my people know that. I take this because I have been requested by my elder, who has since passed away a couple of months ago, when he told me to bring this up to the chiefs. Never let your treaty status expire. That's what he told me. So anywhere we go, they look at our expiry dates now on our treaty status cards, and we have to look out for that. So that's what I would say today, that on this health accord, that this nation-to-nation relationship, direct funding, however it may be, the treaty status also has to be in there, that we declare that we never expire our treaty status and as an obligation from the Crown. Now we hear our life flights, you know, that have been pulled out by the Manitoba government, and it poses a lot of problems with people up north that don't have access to road transportation. So those are the type of issues that we have to look at, and I certainly hope that this message of my elder, that our treaty status do not expire, moves forward, and that it should be declared as a part of this health accord, so that we do not erode our own treaty status. This is what the government is looking for. You know, they're breaking us up one by one. Regional authorities throwing bucks at every political organization, and then we have to fight for that, our own. Like, there's 4 funding mechanisms that have been thrown to all the political organizations. The MKU, SCU, AMC, yet we're going to be doing the same thing. So that's where we had to put this renewed relationship in this process, because we feel, I'm sure we all feel for our people, and we work for the best interest of them, of our people. I hate using a racist racial comment, but the policies sometimes are very racial, actually racist policy.
They all are.
So that's what we have to try and put input into this health accord, that there is equitable health standard, objective standard for our people. And that is what we have to look forward to, hopefully. So, Tegusane, that's all I wanted to say, is to bring that message from my late elder. Don't let our treaty status cards expire. That could deteriorate our treaty obligation of the Crown to provide for that medicine chest. Tegusane, thank you.
Thank you. That's it.
Do you have a resolution?
Oh, microphone 26.
Chief Batson, Pine Creek First Nation. Just in regards to the health, the Unity Accord on First Nations health, in there it does state about executive councils of AMC, MKO, and SCO shall endorse strategies, actions, and structures that are arrived at pursuant to this agreement. And as was just stated earlier, SCO, or the chat table, was not consulted in this process and in this material that you're presenting here today. So, and I also noticed in your resolution, it states that with the task force that's going to be created, you have the FINISM board. Those members will be on the task force, as well as an additional 4 to 6 new chief appointments. Island Lake, Tribal Council, Independent, Northern, First Nation, Dene, and Dakota. But in your therefore be it resolved, it states the 4 chiefs that'll be appointed, and also that the others are only to be considered for nominations. So to consider nominations from Dakota Nation and the appointments of the chairperson from SCO and MKO Chiefs Health Action Tables. So basically they're being left out, SCO and MKO, because we're only to be considered for nominations. You know, if we want to be inclusive, which according to the Health Accord, we are supposed to be united and working in unison. And this resolution going forward does not state that, because we're already leaving out Dakota Nation, as well as the 2 chairpersons from SCO and MKO Health Action Tables. So I would not be supporting this resolution, and I would like to see it amended to state that those chairpersons will be on this task force if it goes forward, as well as representation from the Dakota Nation.
Absolutely. That was my mistake. My apologies, Chief.
Okay.
The language wasn't strong enough, but we'll make that amendment.
Thank you. I got too many papers here. I probably have it here somewhere.
Give her so she can carry on.
Oh, here it is. There it is. Okay. Oh. Can I just add to that? I guess my mic's still on, so. In regards to, okay, so if this task force goes through, what representation will, and I don't, maybe you can answer this, I don't know if this has been determined at this point, Chief Eugene Eastman, is he representing West Region Tribal Council? Is he representing Treaty 2? Because in looking at the, I guess the, all of the other chiefs that are included in here, then that would mean that West Region Tribal Health Services is then not represented.
Okay, that's a question I'd have to ask Ardell.
So yeah, so I don't know what role, like who is he representing? Is he representing West Region Tribal Health? Is he representing Treaty 2 as their Grand Chief? So I think that needs to be determined as well.
Sure.
Thank you.
Thank you for your question, Chief Batson. Ardell Cochran, the Executive Director for FINISM. Our board is comprised of Tribal Council appointments. So how they're appointed is they're appointed through their Tribal Council, and then it goes to the AMC Executive for appointment. And then in September, which is, mark your calendars, our First Nations Health and Social Secretariat Annual General Meeting. So there it'll be ratified. Those appointments will be ratified. So we have no one representing the treaty areas at this point. Thank you. As for the Island Lake vacancy, we do have, we had a discussion with the Tribal Council, and that position will be filled by Chief Gary Knott from Wasigamac. The Northern Independent will be Chief Anderson from Norway House Cree Nation, although we're still waiting for the official appointment through the AMC ECC, whenever their next meeting is.
Okay,
Chiefs, if I may, I want to wade into the conversation here. For posterity, I want to remind the chiefs that at my first assembly, this is one of the initiatives that I had asked of you to allow for me to pursue and work on. Simply put, prior to becoming a chief, I was a health director for my nation. My community is one of the first communities to negotiate a health transfer agreement with the federal government. I'm very well versed with those types of arrangements and agreements. And through trial and error, I've learned a lot from my experience. And it's very important that when we're moving in these directions, that we make the best informed decisions possible. Because it may be a surprise, but some of our federal counterparts are not the most trustworthy people when we're dealing with them. So fundamentally, the initiative that we worked on for the Universal Health Accord was to pull the jurisdiction and legislative mechanisms for our overall health care and our resources, and they should come to our nations, because nobody knows other than ourselves what it is we need in order to look after our people. Back in 1986, when my community negotiated their health transfer agreement, and everything was sunny skies and beautiful, beautiful clouds, and everybody was championing it, we negotiated our O&M for our health center. And then when I became health director in our fourth generation of that agreement, I started seeing that no matter how hard I worked with my finances, that it just couldn't make ends meet. I just couldn't do it. I had obligations with my agreement. I had to look after maintenance. I had to look after these things, and it was really hard. But because we were going into a negotiation of our agreement, I had gotten experts to do a financial analysis on everything that we were doing and how we were trying to provide service for our people. And when I started holding our federal counterparts accountable, lo and behold, one of them came forward and said, "Oh my goodness, Health Director Dumas, I don't know how this could have been, but we forgot to give you Schedule B of your O&M for 15 years. And I was like, well, how much does that equate to? And it made sense, because Schedule B was for little things: painting your walls, making sure your doors are functional, making sure your tiles are good, making sure your thoroughfares and everything was good. It helps to me. But so what was ending up happening was, in order to do all of that stuff, to meet my obligations, I had to steal money from myself to do that. But then they came and said, "I'm sorry, we're sorry. We didn't give you $66,000 a month for the last 15 years. Oh my God. So I asked, well, why didn't we get that money? And the response was, because you didn't ask for it. And my point is, chiefs and the assembly, we need to make informed decisions. And going to Chief Batson's comment on why wasn't SCO part of the process, I gave my conviction that this was a completely inclusive process. And I will ask my staff to verify the amount of times that we tried to engage with everybody. The door's open. At any moment, anybody could come on board. There were times where by mistake we forgot to send a message. Sorry, come. We need everybody, because at the end of the day, only you yourselves know what's best for your communities. And we need our resource people. We need our people, our resource people that are at SCO. We need our consummate experts that are at Southeast. We need all of these people to come, because that is how we will make informed decisions. I don't want to split hairs. I don't want. If you want to develop a health authority, by all means do that. If you want to achieve a complete sovereign operation, please do that. But fundamentally, none of that stuff will happen, or we won't be able to wield that to the maximum effect if we don't have the legislative and jurisdictional authority to do so. And I don't want to have to listen to the province or the federal government. Like I said to our federal people today, give us our money, we'll look after ourselves. When our grandfathers and grandmothers did Wabang and they actually laid the road work for us, I wish they would have listened to them 50 years ago, because we would all be autonomous and sovereign today. So I can only tell you that I've insisted that my staff be inclusive, and I won't allow for the splitting of hairs, because time is precious. Time is so precious, and unfortunately we're in a blackout period. We're going to be heading into a blackout period between the provincial and federal government, and now we're going to have to wait. Now we're going to have to wait for, hopefully, a government that's going to want to be working with us again. Time is precious. I rely upon our doctor in this audience right now. We have doctors, we have lawyers, we have accountants, all our own people. I rely on all those people to help us move in the way we need to move, and that's what I want. I want legislative and jurisdictional discretion over our resources. And I want to leave that up to the chiefs to decide what it is they want to do for themselves. And I want it to happen tomorrow. So I just wanted to leave you with all that message, and this will be something, my chiefs, that we're going to be pursuing aggressively, because, you know, if the government changes, the world can be a different place. I reported to you, each and every one of you, the 2016 money that was held back. The previous government withheld billions of dollars from us because we didn't follow their education plans. They withheld billions of dollars from our people, funds that should have reached our communities. It's in their audits, you can see it yourselves. But anyway, I know it's getting to the end of the day, chiefs, but we need to expedite these things. We need to have faith in one another. We need not to build obstacles and difficulties, and let's do it. Let's get this thing. We have all the right people in the right places, and I really want us to make this thing a reality, and I know that we can do it. So if I've offended anyone, that wasn't my intention. I'm a little fired up. I'm really excited. I want to get these things done, and it was not my intention, but I know we can do these things. I have faith in my Grand Chief counterparts. I have faith in our regional chief, and we can push these things. We just gotta get them where they need to be. He goes, thank you.
Resolution is still being drafted. Is the resolution ready? I have another one that we can go forward with while you're working on that one. Do you want to do that? We have 12 resolutions that we have to attempt to go through. In total, in 12 more.
Just do all the whereases.
That's why I want to move towards number 3 It's relatively an easy one. We have the mover and the seconder present, and it's accepting the National Inquiry Report on Missing and Murdered Indigenous Women and Girls. And it also has another whereas in seeking funding to do some work. Can I go ahead with resolution 3? Okay, go ahead. Resolution number 3, it's been circulated. Be it further resolved that the chiefs in assembly support and endorse the recommendations that include the federal government to meaningfully support and fund a Manitoba First Nation specific response by AMC for 2 regional summits in Manitoba for the purpose to bring First Nation elders, knowledge keepers, community members, and technicians to coordinate a 10-year plan to support First Nation governments and self-determination. Finally, be it resolved that the chiefs in assembly direct the AMC Secretariat to seek funding specifically for, number 1, 2 Manitoba Regional First Nation Summits, a Women's Leadership Summit to deal with matters relating but not limited to human trafficking, sexual exploitation, resource extraction, child welfare, justice, and policing. Number 2, a prevention summit dealing with matters relating but not limited to health, education, housing, racism, awareness, and education, and honoring loved ones. Number 2, the development of a 10-year plan based on the information gathered from the Manitoba Regional First Nation Summits to support First Nation governments and self-determination. Moved by Chief Viola Eastman, Chinoapa, seconded by Chief Karen Batson, Pine Creek. Does the mover and seconder wish to speak? Microphone 25.
Hello, good afternoon. I believe the resolution is self-explanatory, and I ask the chiefs in the assembly to support us to carry out the recommendations. Thank you.
Seconder, do you wish to speak? Microphone 26.
Hello, Chief Batson, Pine Creek First Nation. What she said. No, I support the resolution as well. You got you.
Thank you. We'll entertain questions.
Question.
Question has been called. All in favor? Okay. Any against? Any abstentions? Resolution is carried. Number 3. Okay. Resolution number 1. While we're waiting, it was handed out yesterday, and I'm going to only read the be it resolved. Therefore, be it resolved that the chiefs in assembly support the AMC Secretariat seeking leave to intervene at the Supreme Court of Canada in the case Consul Scolaire Francophonie de la Columbia versus British Columbia Education. See, my French is not very good, is it? Further be it resolved that the chiefs in assembly directs the AMC Secretariat to work with the Public Interest Law Center to file the necessary motion and materials. Moved by Chief Batson from Pine Creek, seconded by Chief Murray Klersky, who is not here, so we will need Okay, Chief Hudson. It's been duly moved, seconded. Does the mover wish to speak? Microphone 26.
Chief Batson, Pine Creek First Nation. So this is just in regards to looking at language rights and the case that was in BC. There was a briefing note that was provided as well if people want more information. But basically it kind of will tie into our language revitalization strategies and trying to keep our own languages alive, and how this case would impact that. So we're asking that the AMC Secretariat work with the Public Interest Law Center in order to file the necessary motion materials. Miigwech.
Thank you. A seconder, microphone 30.
Yeah, no, I second the motion, but I did just want to confirm that the Public Interest Law Center would undertake the filing, and if not, that we have it filed with the appropriate legal firm. Okay, so I second the motion.
Okay, thank you. Okay, we'll entertain question.
Question?
Questions called, all in favor? I think we have one by consensus. We have one by consensus, it's carried. Number 2, the one dealing with Greenhouse Gas Pollution Pricing Act. Again, therefore be it resolved that the Chiefs in Assembly supports the Assembly of Manitoba Chiefs seeking leave to intervene at the Supreme Court of Canada in the case dealing with Greenhouse Gas Pollution Pricing Act. And finally, be it resolved that the Chiefs in Assembly direct the AMC Secretariat to work with the Public Interest Law Center to file the necessary motion materials. Moved by Chief Glenn Hudson, seconded by Chief Elwood Zastry. I believe that Elwood Zastry is on the road somewhere, so we'll need a seconder. Do we have a seconder for this motion? Basically the same as the last one, to intervene on greenhouse gas. Do we have a seconder? Seconded by Proxy Oral Johnson. Chief Hudson, would you like to make any comments? Microphone 30.
I think it speaks for itself, the resolution, but I just wanted to make the statement that we need to look at taking the lead in terms of ensuring our environment and principles associated with UNDRIP and the rights of our First Nations are kept intact. And I think conservation and protection of the environment is something that we need to take the lead in and continue to promote for society. That's our responsibility, obviously tied into our traditions and our cultures. So just wanted to make those comments, but I move this motion, resolution.
Thank you. Microphone 5, you're okay?
Yeah, what he said.
Thank you. Entertain question? Question's been called. All in favor? Okay. I guess we're going to court. Anyone against? No abstentions? Carried. This one's okay now? Okay, this one is regarding the last presentation, July 19th, 11th, that's been circulated. It identifies the various committees and board, FNISM board, the addition of some names, and then of course from SCO and whatnot. We don't have a mover for this. Oh. Moved by Chief Moody, proxy Orwell Johnston. The resolution. Therefore be it resolved that the chiefs in assembly nominate and appoint Chief Dennis Meaches, Chief Glenn Hudson, Chief Tony Powderhorn, and Inigonio Sinclair as members of the CTFOH. Further be it resolved that the chiefs in assembly appoint a representative from the Dakota Nation and chairperson from SCO and MKO Chiefs Health Action Tables. We do have a mover and seconder, both present. Do you wish to speak to the motion, the resolution? Mike 9.
Hello, I'm Chief Moody, NCN. No, I don't want to speak for the resolution, but we want to make it more inclusive, as was presented by the previous presenters, and so I do move, and I do support the resolution.
Thank you. Microphone 5.
Councillor
5.
Councillor Orwell Johnston, Black River. Just a comment to read statement of the Chief's Task Force on Health, and now with the changes in the resolution to include those that wanted to be a part of, and the inclusion, all the things that we asked for are here now in the change. So I'm glad to second the motion.
Thank you. We'll entertain question. Any further discussion? Question's been called. All in favor? I don't see anyone against. No abstentions. The motion is carried. Resolution number 12. AMC calls on the Government of Canada to discontinue using the taxi services in Manitoba for First Nation citizens. Therefore be it resolved that the chiefs in assembly direct the Grand Chief to work with Indigenous Services Canada and First Nation Inuit Health Branch to discontinue working with the taxi services in Winnipeg in favor of First Nations transportation services and develop a service model that provides culturally appropriate and safe transportation. Be it further resolved that the chiefs in assembly direct the Grand Chief to meet with ISK Minister to discuss how to develop economic development opportunities for First Nations in Manitoba to provide transportation such as Ikwe and Nietzsche rides. Moved by Chief Doreen Spence from the Tasqueya Cree Nation, seconded by Chief Marcel Modi from Misichawayasik. The mover and seconder, do you wish to speak? Is Doreen here? Microphone 13.
seems so weird. Hello, I'm Chief Doreen Spence to Tasquia Cree Nation. I just want to make a comment that as we're all aware of the issues regarding the taxi services here in Winnipeg, and I believe that we need to proceed with this in terms of protecting our women, our children especially. And I have a representative here, Ted Bland, on behalf of York Factory First Nation. He would like to make a comment as well.
Thank you, Chief. She told me to hurry up, so I'm going to be very quick. Chief Constant is not here today, obviously, but I did speak to him on this, and I want to say thank you to Chief Spence and Chief Moody for their support. Originally, what I wanted to hear was to stop the flow of Indigenous dollars to Duffy's Taxi or Unicity. We've all heard the stories from our patients, from our women. About a month ago, a lady from my community who has cancer was going into a taxi. She was a couple of minutes late. The taxi driver yelled at her all the way to the hospital, and she has cancer, like she hasn't been dealing with enough. A week later after that incident, I saw on social media these young ladies were in a taxi and they were being taken out of town by the taxi driver. I think many of you may have seen this video. It is a real video, and there's many more like it. These young ladies had to jump out of the taxi to most likely save their own lives. I honestly believe there are predators in Duffy's Taxi. They assault our women. They kidnap them, and I have no doubt in my mind that they've taken many of our women and they've murdered them. I've said this before many times. I hate the thought of seeing them receiving Indigenous dollars, because we're talking up $10 to $20 million annually, and we go to the Hydro Board, they don't do nothing. We go to the Winnipeg Police, they don't do a damn thing either. We've gotten so used to hearing about this, but not doing anything anymore. I want money back to our people. They contribute absolutely nothing back to our people. With all the money they receive annually for all these years, they give absolutely nothing back to us. So I'm hoping that we can support women's companies like Ikwe or Nietzsche Rides, or establish brand new companies through business terms that would be negotiated. So I asked the leadership, the women, the proxies, the chiefs to support the resolution. Negose.
Thank you. Chief Moody.
Chief Moody, MCN. I agree with Chief Doreen Spence and Ted. I think we have to stop, putting our people's lives at risk. I think it's dangerous, and it provides a real opportunity for economic development for our people as well. I think if people see that we provide the service for our people, they'll be more receptive to, and feel a lot more safer to jump in these vehicles that are owned by our own people. And our people are looking for jobs here in Winnipeg, and if we can do something for them here, I think it'll be great for our people as well. But above all, we don't want to put our children and women at risk all the time. So I second that motion.
Thank you. We have the resolution. Mover and seconder have spoken. We have a direction for the Grand Chief, and we'll entertain question. Question called. All in favor? It's by consensus. Thank you. We have four more, and this one needs a seconder. Mover and seconder. Manitoba First Nations Early Child Care Framework Strategy. And I will read the therefore be it resolved that the Chiefs in Assembly direct the AMC Secretariat to continue to flow the ELCC funding allocations to all First Nations in Manitoba as identified in the proposal, and that the AMC Secretariat not charge an administration fee. Okay, that's your resolution. Mike, resolution number 10.
Chief Mitchell, moving that resolution.
Chief Mitchell, thank you. Seconded by the resolution is Manitoba First Nations Early Child Care Framework Strategy. We have a seconder. What's the name?
22.
Microphone 22. Please identify.
Good afternoon. Councillor Sean Kent, proxy, Broken Ojibwe Nation. I second the motion.
Okay, thank you very much, Councillor. Okay. Basically, all this does is give the AMC the ability to go to the government and say that we'll be the flow-through with respect to ELCC dollars, and we will not charge anyone any fees. We discussed it earlier. Mover, would you like to speak? Chief Mitchell?
Chief Mitchell, just to add to that, you know, everybody hopefully saw their money flowing on early childhood, on developing your own strategy. But we want to provide a forum for our daycare, all our early childhood people to come together to create a strategy for early childhood in our communities. And I say again and again, one of the biggest issues that we have in our communities is we don't have the infrastructure to support our own early childhood learning, whether that be an immersion learning center or an early childhood center. I think that's one of the things we have to really key ourselves on and ensure that our people have that as a top priority. Because we all know with the influx of Jordan Principle, it was a welcome, but we all know we squeezed them into old buildings or our overcapacitated schools. We didn't